mnemonic is two. Okay, you will have decrease LDL receptor signaling. Either decrease LDL, either decrease. Okay, you know the either you will have increased PCSK9. So in this period, you have 3A, increased atherosclerosis, early onset of MI, increased epistendoxanthoma, and corneal arcus, 3A mnemonic. Recurrent Neisseria infection, terminal complement deficiency. Early complement deficiency increase the risk of SLE. Late complement deficiency, the recurrent Neisseria infection. Okay, you can write those differential. Male child, recurrent infection, no mature beta cell. So that is Bruton. Bruton for boys. If boy is coming with recurrent infection, recurrent pyogenic infection due to encapsulated bacteria, or recurrent giardia infection, recurrent your gut infection. So that is due to Bruton disease. Anaphylaxis with following blood transfusion. It is IgA deficiency. Remember, very high yield one. Also, you will have recurrent respiratory tract infection, recurrent gut infection. You will have risk of increased autoimmunity. That is okay. So that is IgA deficiency. Then is recurrent cold abscess, acasma, high serum IgE, increase eosinophils, mnemonic is given. Okay, you have to be 17 to get a job. Okay, so that is mnemonic is A, B, C, D, E. Abscess, okay, B for is like that mnemonic is cover in first aid. Okay, so everything is given here. Okay. Then is a LAD. First L is for late suppression of cord, okay, and absent pulse, okay, and then is a mucosal bacterial infection, that is LAD, leukocyte adhesion deficiency type 1. There is also type 2 and type 3. There is recurrent infection and granulomas with catalase positive organisms like S. aureus, Serratia, okay, Aspergillus, okay, there are multiple ones. So that will be chronic, okay, granulomatosis disease, defect of NADPH oxidase. The next is fever, vomiting, diarrhea, okay, rash following use of nasal pack or tampon, very important. This history will be given. Okay, shock-like condition will be given. Fever, vomiting, shock, rash, that is staphylococcal toxic shock syndrome. Okay, then is strawberry tongue. It is given in these diseases. Scarlet fever will have sandpaper, rainbow like rash. Okay, that is scarlet fever. You will have also have multiple other findings. Kawasaki disease. Kawasaki disease, you will have okay, you will have lymphadenopathy. Okay, you will have you will have oral ulcers. Okay, you will have in Kawasaki disease, you will have conjunctivitis, rash and palm and soles, high heart rate. Okay, so that is a mnemonic we have this. Okay, we have covered the mnemonic. Our kid is riding the Kawasaki bike. Okay, palm and sole on the steering, and then you are having red eyes. Okay. In this case, you will have risk of actually not coronary artery aneurysm. That is Kawasaki disease, strawberry tongue. Colon cancer associated with infective endocarditis. It is Staphylococcus bovis. There is another organism right down in the book. It is Clostridium septicus. Clostridium septicus can also cause is associated with colon cancer with infective endocarditis. Flaccid paralysis in newborn after ingestion of honey. It is Clostridium botulinum infection, floppy baby syndrome. Guys, here you remember the point in newborn. It is the spores that will cause issue, but in adult, okay, actually in you can say in newborn it is the toxin. It is the spore that will cause issue. In adult, it is a toxin that will cause issue. That is the difference between them. Then is a Okay, then is a classic point, abdominal pain, exclusive watery diarrhea, leukocytosis, okay, around about 1500, mean more than 15,000. Okay, excessive mean more leukocytosis. And then is recent antibiotic use, okay, like the clindamycin, PPI use, hospital history, okay, and then you will have low grade fever, that is Clostridium difficile. You will have watery diarrhea, remember it. Tonsillar pseudomembrane with bull-like appearance. You will have Corynebacterium diphtheria infection. In this case, you can have myocarditis, you can have okay CNS issues, back pain, fever, night sweat. Okay, whenever question will be given of port disease, back pain, history will be given of immigrant. Okay, or if the okay TB history will be given, other immigrant history will be given. So it is a port disease. Adrenal insufficiency, fever, DIC, that is meningococcemia. Okay. Red currant jelly sputum in patient with alcoholic or diabetes. This is Klebsiella pneumoniae. So alcoholic, you remember with club. You know, in club you eat alcohol. Okay, so that is a then large rash. Okay, with bull-eye appearance. Okay, bull. Also, we can say target appearance. Erythema, migraines from exotic bite. Lyme disease also can cause Borrelia. Okay, can also cause anaplasma. So that is a bull-eye appearance. Next is ulcerated genital lesions. Okay, here you will have remember genital lesion, painful and non-painful and painful. Okay, for painful, it is the you can say chanceroid. Hemophilus do cry. Do you cry? Okay, so in this way you can remember. Also, the herpes are painful, but other are non-painful. Indurated like chancre, primary syphilis, trypanosoma palladium, they will be single lesion. It will be pain non-painful because okay, so okay done. Then is smooth, moist, painless, wart-like lesion. That is due to HPV, condyloma lata. Okay, like HPV, like secondary syphilis. Okay, it is due to secondary syphilis. Okay, then pupil accommodate but doesn't react to light. It is called. It is due to neurosyphilis. It is agile, robust pupil. It is also called prostitute pupil. Fever, chills, headache, nausea following antibiotic treatment for syphilis. This is a reaction. It hosts, it is good. It is good. It shows good prognosis. It hosts response to sudden release of bacterial antigen. Then is the next one. Okay, you can see dog or cat bite resulting in infection. You can have cellulitis and osteomyelitis. Remember, cellulitis, skin infection. Under the skin, you will have bone. You can have osteomyelitis. Most common organism is Pasteurella multisoda, cellulitis at inoculation site. By human bite, organism will be different. Atypical walking pneumonia with X-ray looking worse than patient atypical pneumonia. Patient will be young, healthy. It is Mycoplasma pneumoniae. Okay. Then is a rash and palm and soles. Mnemonic is core. Coxsackie. Okay. Coxsackie A. R for Rocky Mountain spotted fever. S for is cores, syphilis. So these three organisms called rash and palm and soles. Also, there are some anaphylactic reaction that can cause a rejection that can cause rash and palm and sole. In the case of staphylococcal toxin syndrome, you can have rash on palm and sole. In graft versus host disease, you can have rash and palm and sole that will resequentize. Black ashore on face of patient with diabetic ketoacidosis. Very important point. In DKA, you will have mucorrhizobs. And classically, it will affect your uh, here you will have necrotizing sinusitis. Okay, then is a is okay, okay, 3C in congenital toxoplasmosis, chorioretinitis, syphilis, and intracranial calcification. So that is congenital toxoplasmosis, 3C pneumonia. Pruritus, serpiginous rash after walking barefoot. Okay, it will be hookworm because hookworm larva enter from your foot from barefoot. Okay, so it can cause serpiginous rash.